All right, you're welcome back to our lecture. Okay, so we go over to AM 221, actions and uses of medicines. 2. The topic is routes of drug administration. In our last class, we discussed drug nomenclature, right? And we answered revision questions therein. I believe that what we did in that class is clear, right? And I believe that you'll be able to answer questions. Okay, what did you ask? Okay, 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 okay. Let me see it. Let me see it. Thank you, Mama Alpha. Come on, talk to us about meperidine. No, I come. I'll give you a few minutes to tell us what you. No problem. I say it. No problems. Okay. 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 Anyway, the basic thing there is that they have is just the same generic name. It's the same. The two generic names are the same drug names for the same what chemical drug that had for the same drug. Just that different pharmacopoeia and they may give you different names. Just as we have it as acetaminophen and what paracetamol. It's the same drug. Okay. Okay. There's a question here. Okay. Okay, the name is Artemether 80 milligram lumefantrine 480 milligram. What is it PHINT? They wrote Artemether 80 milligram lumefantrine 480 milligram tablet PH.INT. What does it mean? It's not true. Huh? Is a pharmacopoeia. So what pharmacopoeia is that? International what? Pharmacopoeia now. See it now. It's international. Did you do it in your first year? Is there in your material? International pharmacopoeia is there. It's not there. It's there. I mean, I see this is how to write generic name. If the pharmacopoeia is coming from must be there. This is not BP. It's not USP. This one is international word. Okay, it has it come on, please. Is international word pharmacopoeia. So let's now go to what she was trying to point out before we go into what we have. Okay, she was like, why this one doesn't have any brand name? Yes, it's not a must that it may have a brand name. Am I communicating? It's not a must, though. But this one can be taken as attempted way factoring from Oreto. Oreto what? From Asticos. Am I communicating? But this one, do you know? This is also a business strategy. You know that this attempted lumen factoring is common. Two of us. Hey, or 2 seconds kick it here. Okay, key and the password. Child. I must see trust. Child. Then a boy, they play. Okay, look at it now. There's no brand name. This also can serve as a business strategy, as a marketing strategy. You know that this attempted loop is common already. Am I computing? Now, writing it just like that, attempted loop can even sell this brand. But I don't know how many brands, how many that have their name like this. Do you know that others may be having their name, Lonat, Amatem, short names, Goatal, but they can tell somebody, please, just get a Temeta Lume Fantry. Please me just walk into for please give me a Temeta Lume Fantry. The person may just look for the one they wrote a Temeta Lume Fantry and give to the person, and he will go. Am I communicating? These things are normally some company don't like wasting their time trying to brand a product that is already selling on its own. Am I communicating? Already selling on its own. And also some don't want to pass through the stress of branding, giving a name and carrying it up and down and trying to. Because they know that once people just enter the wholesalers and say, please give me any brand of Atemeta Lume. You just give me Atemeta Lume for trade. And they will get it and go and sell. Because it's common. Am I communicating? So it's not compulsory that they must go and look for branding, because branding is also another issue. You go to register the name. It's a trademark. Register it, then come back and start pushing it. You wasting time. Okay, this one is the name is Chetal. It's for you have to detail it, push it for that name to sell. But the way for trade is already a selling name on its own. Am I communicating? It's already a name that is selling on its own. So someone can easily adopt it and just leave it like that without going for any further branding. But maybe those that know much about it may just say, okay, please give me the one from Oreto. Am I communicating? But if not, just you know, it is a prescription. It's an over-the-counter medication. Anybody can walk into any pharmacy and say, please give me Atemeta Lume Factory. And some people may not even know much about the different brands. They'll just go and say, what do I do with this human being now? So what happened? Okay, she don't even know what happened. That one is even the worst. She see nothing in what she did. She was saying what happened. Those that recognize what they did are standing there. And she's even sitting down. Almost see you. Those that know that they have effort are even standing there. See them standing. And she's just walking on you to go and sit down. And you may end up going and they'll go and sit down. And I think that is what may happen now. Because you know, oh, he's even saying no. Go and sit down. Alright, so is it clear? Is it clear? It's not compulsory that you must go and start looking for no. It's not compulsory. Branding is just a personal stuff because you want to create a name for yourself so that if you succeed, do I use the term force or sell? Okay, let me use selling the name to people. Even a small boy will go to say, please give me, you mention that brand. But if not for that, it's not compulsory, you must not. Yes. It's a generic. Nobody owns a generic name. Remember, are you aware? Nobody owns a generic name. It's when you go and start putting Oreto in your own. That's when you are looking for that trouble. You know the name of the company is what? Oreto Pharmaceutical. This should be from okay. It's Anambra State here, Mbakwe Street. Is the company is Anambra. It's when you go and start using their name. That's when you have issues. But a Temetal Lubricant doesn't belong to anybody. The innovator brand, the company that first worked on it, they have enjoyed their patent rights, and their hands are what? Off. Is when you go and start using that brand name, their own brand name, those people that discovered it, that's when you have issues with them. And this one too, you can go and use that it doesn't belong to anybody. Just like paracetamol, it's a common name. It's in the pharmacopoeia. It doesn't belong to anybody. You can decide not to brand your paracetamol a particular name. You can just write paracetamol to tablet. But with the name of your company there, people can easily say it is, just as we have Emzo paracetamol, it is paracetamol from this company. And I don't know if you're making sense. Yeah. So that's that. So it's not compulsory you must go and start looking for a name. If you want to, maybe you have enough resources, or maybe you feel that you want to create a name that will be in the list of people, as I said before now. That's when you can do a thing like that if you have the money, because it doesn't end in having a brand name. You must market it. You must push it. If you don't push it, some people know that your brand is paracetamol. Yes. Some people not even know that your brand is what? Paracetamol. But you may see someone that just wrote paracetamol selling more than you. Because anyway, can you please be a paracetamol? So far, all what you are now, yes, paracetamol, you will take it and go his way. It's paracetamol. All right, so now let's go to the topic for today: routes of drug administration. Now, in your first year, you did. I'm building up on what you did in your first year. Now, you did drugs and medicine, and you also did how to produce medicine from where? Drug. Am I correct? Drug, right? Now, if you now produce that medicine in different dosage forms, right? Now, that medicines you produced, you have packaged it, distributed to different outlets, pharmacy, community pharmacy, hospital pharmacy, other institution where you have pharmacy, right? Patent medicine shop, they all get this drug and this medicine, and patients, doctors will prescribe, pharmacists recommend, and other they will go to there, whether OTC or over the counter medication, whether POM, prescription only, whatever it is, the patient will get the medicine. Now, How will this medicine get to the site of what? Action. That's the big question. And that is a very important aspect, because if that drug, if that medicine doesn't deliver this drug to the site of action, is a problem. All the efforts of the pharmacist trying to, even all the effort of those that synthesize the drug and those that formulate it and package it and distributed it, and the doctor that prescribed it, and you that spend your money to buy it, and at the end you could not get to the site of action, is bad. It's nonsense. Two of us, you wasted. Is a waste. So routes of drug administration is a very important topic. You don't play with. So this will take us to the definition. What is routes of drug? You already have this material, but you can put down if you want to. You already have, but I'll just look at it, dictate one or two things, and then explain. The most important is for you to understand what I'm saying, okay? So what is routes of drug administration? The routes of drug administration is simply, can be defined as what? As the path through which a drug is taken into the body for diagnosis, prevention, cure, or treatment of what? Various diseases and what? Disorders. Of course, you know what a drug is, right? A drug is, right? A drug, that's the definition of drug is inside this what? Definition. If you can, who can point out where the definition of drug appears inside this? Diagnosis, right? Prevention, right? Cure, treatment, good. So, specifically also the definition of medicine anyway. So, routes of drug administration is the path by which a drug is taken into the body for diagnosis, prevention, cure, or treatment of various diseases and what? Disorders. Now, as I said before now, that drug, for it to be able to exert its pharmacological action that will result to therapeutic effect. Hope you know that is pharmacological action that will lead to what? Therapeutic what? Effect. True of us. So for a drug to exert its pharmacological action that will lead to therapeutic what? Effect, it must, put me anywhere, it must come in contact with the cells of the tissues and the tissues of the organs of the system and the system of the body before it can exert it cannot just be floating in the blood. If it just float in the blood and go, it will not exert any effect, depending on the target. Am I communicating? So there must be that contact. So it must be distributed. Remember that pharmacokinetics, you did for pharmacokinetics, right? Yes. About your absorption. You know that when you take the dosage form, be it tablet, be it capsules, be it suspension, be it elixir, be it syrup, whatever the dosage form, when it can come in contact with the body, that dosage form must come down to be able to release the drug that will now be absorbed and distributed from pharmacokinetics. Released, the drug will be absorbed, distributed. Am I communicating? So get a set of action. Some may undergo first pass metabolism before even, maybe at the end they may not even get up to the quantity that will be able to do exert their effect in the system. But in summary, it's through that distribution that this contact is established. If it's not distributed, there will be no contact with the where it should be, especially the one that has systemic effect. But local effect is already there in contact with that site where it is deposited. Am I communicating? But whether it is locally or systemically, there must be contact with the cells of the tissues of the organs and organs of system. There must be contact for effect to be exerted. So this will now lead us to since we now know how important this route of administration is. Just like you are coming from the hostel, right? And you know, before you can enter, before you can enjoy this class, apart from those in their house, I'm drinking tea and watching us live now. Apart from them, for those inside this hostel now, before you can come into this place and join this lecture, you must pass through this what door, this path, right? So if you end up not passing through this, right, you'll not be able to do what? Enjoy this lecture. So if the drug doesn't pass through the right path, there will be issue, and the body will not be able to. If the body is already diseased or disordered, there will not be. You will not exert therapeutic what effect. So because of how important this route of administration is, there are factors that influence the choice of route of what administration. It's not just about formulation. You also think about the choice of route of what administration. You consider the right route you use to be able to achieve the therapeutic what purpose, and that route, that choice will also play a role in the type of dosage form you will do what formulate for that what drug. If the drug has, there will be issue when it gets in contact with the gastric juice. You try everything possible to bypass that what stomach, true of us, so that the drug will remain intact. Is also this will not give you the right choice of what administration. Am I communicating? So now let's look at the choice of factors that influence the choice of route of what administration. Number one, who I want us to look at is the what? The physicochemical properties of the drug. The physicochemical properties of the drug. So you have to consider the physicochemical properties of the drug before you can say, okay, this is the right route you can use for this what drug. What are those properties you consider? You consider things like is it in the solid form? Is it as gaseous what form? Am I communicating? Now you want to formulate, you want to deliver a drug that's in gaseous form in the system. Then you go and start using it as. Can you formulate it as a cream? Topical, right? You're wasting your time. Two of us, you are wasting your time. It's not true. Good. And also, so the nature also, is it in solid form? This is solid form, right? And this drug is in solid form. How will I, on a normal, what do I do to be able to convert this drug inside the what system? Okay, if there's nothing you can do for you to exert its effect, it must be in that solid form. You know, there are ones that it must be in that, like powders. You want to maybe externally use powders. There's no way you can make it to become liquid because you want to use it externally. True of us. So these are factors. And also in our last class, remember solubility and pH. The effect of pH. I think that should be when we are discussing solubility, right? The buffer, because of the buffer level of the what? The rectum. Can you remember those ones we did? And also, even when we discuss the ionized and unionized forms of drugs. So which one that is absorbed well? More ionized or unionized? Unionized, okay. Someone said ionized. It's unionized, okay. Now, so these are things you consider. Look at the drug itself. What are the inherent properties of the drug itself? That will also give you a clue on how to formulate it, the right route you can use to be able to deliver the drug without losing the drug. Are we together? The next factor you consider is what? The site of action. Which site of action do you want this drug to get to? Where do you want the drug to get to? When you say site of action, you consider a lot of things. locally, systemic, local or systemic. Of course, you know that the local side of action is easily approachable. You can easily approach it. But systemic, you cannot easily what? Approach it. Am I communicating? Then you are here now. You are having a very severe headache, right? Very severe headache. And you go and buy diclofenac gel and start rubbing on your head. Will it work? No. But it contains the same diclofenac, right? You can rub it in your head. You always get tear. You see our boy. You are okay, boy. You don't do anything for it. True of us? No, you do not. You must deliver it inside your what? System. It must enter your system. Systemic is not local now. It's not local, right? Systemic must enter there. It must go to the site, of that take care of the pain. Okay, let me use paracetamol. So the point there is that the site of action where you want the doctor to act plays a vital role. It plays a vital, even though there are some external injuries you may have externally, as you are applying locally, topically, you also take something that will take care of you from inside. That one is okay. But most of the time, if you have inside this thing, you can go see your time topically, it will not work. Very, very what? Important. The side of action is very, very what? Important. Then you have malaria, right? Because you have malaria, and people have malaria, then a company will just wake up one day and go and formulate artemether lumefantrine as a cream. Will it work? Plasmodium is in your blood system dealing with you. One human being will go and formulate as what? Cream or even eye drop and give you. Will it work? No. It will not work. It must enter the bloodstream and take care of this what? Because plasmodium is in the blood. This is where the blood and liver, depending on the stage. So it must enter the system. It's systemic issue now. So the site of desired action is very, very important. Now the next factor is the rate and extent of absorption of the drug from different routes. Rate and extent. When you say rate, you talk about what? How fast, okay? Extent, how deep or how long it can act. Now, it can how long it will take to enter the system. Now, absorption. There are some drugs that are well absorbed in a particular part of the body. Am I communicating? Yes. Remember when we discussed some enteric-coated what tablets. Remember. Now we said that it is coated to bypass the what gastric juice, right? Now, if the drug cannot be absorbed in the duodenum, you're wasting your time there. True of us. If you get there, you run away from. Finally, you have run away from where? The stomach. But when you get to duodenum, can it be absorbed? It cannot work. Am I communicating? It's because it cannot be absorbed there. That's why what gives us the confidence in pharmacists to be able to design it in such a way that will coat it with something that will get to the alkaline medium and be able to do what? Break down, and the drug can also be absorbed there. If not, it will not work. Am I communicating? Now, so the extent and the rates of our okay now something like suppository with oil base, you guys swallow it. Am I communicating? Yes, if you start it, the one with oil base, right? It will melt. Does it dissolve? It melts, right? If it melts in the rectum, right? it will still, it has both systemic and local action. Yes, it can be enter this systemic circulation and go and exert the effect. Wonderful. What you swallow, can't enter the systemic circulation? Then you now say because of that, you go and swallow what you used, what they used, or if you remember, I'm looking at you like this. Am I communicating? Even if you dissolve it, even if maybe I don't know how it will even melt then. I don't know how long it will take, if it melt at all. So we need and the administer it through that route, it will work. You insert it. Good. So these are how this determine the route of what? Drug administration. Now, another factor is what? The effect of the gastric juice on that what? Drug. And also the first pass what? Metabolism. The effect of the gastric juice on the drug, the effect of the first pass what? Metabolism. You did that extensively in your first year. First pass metabolism, right? Good. Now, you know that this drug undergoes first pass metabolism, or that this drug, once it enters the stomach, it will be what? Degraded. You now start looking for a way to deliver this drug and bypass these issues, right? That's where you see something like sublingual route, where you put it under the tongue, it will enter the system without passing through the what? Stomach. True of us, it has bypassed what? The what? First pass, and even the what? Stomach. Most fact, anything that enters the stomach must get to where? The liver. There's no two story about that. Through the portal circulation. So by the time you did anatomy, you understand it better. Even your biology, you should know that one is, this is normal biology, O level say. Everything that enters the stomach, unless there's something else that made it to escape it, which is not possible, must enter the what? Portal circulation. So now, instead of swallowing it for it to get to the stomach, there's another way, you look for another route through which it can still enter the bloodstream, because it is after passing through the liver that you now enter the systemic circulation. From there, portal circulation, then you enter systemic circulation. So to bypass that portal circulation, if it's the one that has issue with first pass metabolism, and also to bypass the stomach itself, if it is one that will destroy by what? Gastric juice, you look for other means, other routes like sublingual, even in food, even IV can bypass all these things, so that the blood can still get to the system. In fact, the IV is only that is going to the system straight. Am I completing? So this is also a factor that influences the route of what? Drug administration. Now, another factor we need to look at is how rapid the response is or is desired. So the rapidity with which the response is desired. So how fast do you want it to respond? Somebody is dying. Somebody's BP is very high. Very, very high. Somebody's sugar is very high, hitting 500 milligram per day or 480. Somebody's BP is hitting 200 over 150 milligram mercury, and you get antihypertensive tablet. That's your 110. Will it work? You need what will start acting, at least bring it down, then you start controlling with what? Tablet. True of us, because the tablet will now enter the system, better the stomach, then will stay there, dangle there for some time, and swell and break down. After breaking down, it will take time to be dissolution will taking place. It will not enter it to be absorbed. Then before you after being absorbed, it will not get after all these things, then pass through the liver, then will now enter the systemic circulation. The person will just die. The person will just do what? Die and go. So in such situation, there are injections you can give immediately, but not for a long time. Just give it a monitor. Am I communicating? You go and start giving the person oral tablets for the diabetes, maybe oral hypoglycemic agent like metformin, somewhere that is the sugar level is even almost getting to diabetes coma. If not coma, if not comatose already, you start giving the person a tablet to take. No. At that point in time, you monitor the person immediately as you inject subcutaneously insulin. You are monitoring the person hourly and see how it is going down. Then you do watch for 4 hours. It will go in, you will see it going and shut down. If you get to a particular point, you stop. Then you see how if you can switch and everything. So it's not the rapidity, how rapid you want it to be. Is it an emergency situation, or is it a normal thing you normally do? Maybe the person is still conscious, has no issue, just that the person is not feeling well, feeling fine. You can go back to drug that you don't need immediate. You may not need immediate action. Immediate action. So these are what to consider to know the right route of drug administration. A drug like hydralazine, we have hydralazine as injection for BP. We have it as what? Tablet. Am I communicating? So it depends on what you want to achieve at what time. Even though that drug should monitor, because if not, it will cause what? Even hypotension will take place. Hypotension will take place because the way it decreases the BP is something else. It's not everybody that can monitor it, so it's not what anyone can just give to a patient. Am I communicating? But the summary of what the point I'm making is that the rapidity with which you want the action will determine the route of what? Drug administration. That's the point I want to make here. Now, another factor is what? The accuracy of the dose. The dosage accuracy. Remember, in your first year, I told you something about there are some, like now, something like maybe somebody has what is it called? Has rashes, or maybe maybe skin, whatever. You use bulk powder, right, for external use. You may not bother much about the dose, right? Yes. Dose is not that. You get it and just apply. Now, but there are some drugs that the dose you give is very important. Is very important. If you don't give the required dose, it can get subtherapeutic, or it can even become overdose. Am I communicating? Remember what I told you about some drugs with narrow therapeutic index? Remember, with narrow therapeutic index. But the point I'm trying to make is this: someone that needs this drug at this dose for instant action without mistake. If you want to get a highest accuracy of dose, you start going to IV. Am I communicating? Because you are sure that what you are injecting or infusing, whether bolus or over a time, small and stop, whatever it is, you are sure that what you are injecting or infusing in the system, the dose is actually the dose that is entering the system. Because sometimes if you take tablets, it may not be the dose that you want that may get the system. I hope you know. That's why some drug that needs, where the dose is very important, most of them are in injection form or infusion form, provided that the physicochemical property of the drug itself can allow that. Hope you remember that what I told you about some drug that cannot be in liquid form because of their physical stability. Remember, if provided the physicochemical property of the drug can allow it to be in that form, you can enter the system. If that is even the reason why you see some drugs, some injections, they will come as powder, some will come as liquid itself. Have you noticed that? Most of the time, the reason behind that is that that one in powder cannot stay in liquid form. It needs to be what? I'm just throwing more light to what the first factor. I'm using this section to just say what to say about the first factor. That's why you see some drugs, some injections, even injections that comes as solid, even some oral suspension. They call it powder for injection, powder for oral suspension. What it means that before you use them, you reconstitute, right? Before you inject. If not, it will not work. And if you reconstitute and leave them for a long time, they will do what? Degrade. That will tell you use for some time and do what? Discard. Because they know that if you stay more than specified period of time, it will degrade. What you are giving to the patient of that is no longer that drug. Maybe in terms of the dosage, even in terms of the drug itself, it may form something else. Yes, it may react and form something else. So now that's for the accuracy of dose. So if you want to the dosage, the route that gives you the almost the same accuracy of what you want to give we have the what? The IV. IV is there. Inhalation give you a correct dose what? Accuracy. Now the next factor is the condition of the patient. Condition of the patient. A patient is unconscious. A patient is unconscious, so then you go and get tablet and say, yeah, take Imayonia, Fayania, will you enter? You're wasting your time. That person is unconscious, so you cannot walk. And you need to deliver this drug inside the patient's system ASAP. It's not what? Tablet. True of us. Then the patient is vomiting. You know the patient is vomiting. Then you go and get tablets. Then one will take. You vomit it now. It won't it the thing. Or aqua or it's not tablet will not work. The person is feverish. The person has clinical malaria. Fever headed, the person and the person is also vomiting. That's why please, malaria is this. Are you aware that malaria is very dangerous? Are you aware? One second. Okay. All right, so I was talking about the condition of the what? The patient. Whether a patient that is unconscious, you don't go and start giving tablets. Then a patient that is vomiting, you go and start giving tablet or anything that will enter through the oral cavity. Don't avoid it because the patient will give it back to you. It will not work. And once the patient vomit it, in fact, the purpose will not be what? Achieved. Am I communicating? So the best thing is to give what? Either IM, depending on what you are treating, or IV. Am I communicating? So these are factors that will influence choice of the what? Route of drug administration. So I believe that if you are asked to list or write in detail the factors that influence what? Choice of route of drug what administration, I believe you can write extensively. This your point and explain. This your point, explain, give example. Okay, now let's continue. What's time? What is he saying? Your anatomy is about what time? 11:30, right? Has he communicated you? Has he communicated you? Who is your class rep? Who is your class rep? Who don't wear class rep? Where is he or she? Okay, maybe I'll drop the numbers of all the lecturers handling in each of the classes. I think that's what I will do now. Okay, I left you. Left you. I am Zach up here. See my all right, so I have explained local and systemic route, right? Systemic what? Systemic administration of drugs, right? In terms of drug that are administered locally, systemically, and how the effect on the body. This is not the first time I'm talking about it. Okay. Now, if a drug has effect, maybe if you want to give a drug, administer a drug for a local effect, that means you believe you are sure that if this drug is deposited at this point, the effect will be maximum at that what point. Am I completing? It's not just there are some ailments, there are some diseases. As I think I gave an example about with what malaria. You know that the plasmodium is there in the system, in your bloodstream, and even in the liver, moving around. Then you go and start applying cream on the body. It will not work. You need something that will follow it up in that systemic situation to be able to do what? Take care of it. Am I communicating? Yeah. Now, so in that case now, if you give a drug, if you administer a drug to go up to have systemic effect, that means the drug will have its maximum effect when it enters the system than when it's just localized. Okay. Then, but if a patient has, let's say the patient has oropharyngeal candidiatis, it's a fungal disease inside here, the back of your tongue, right? Have you ever noticed a baby, or even mostly babies and some patients, if they open their mouth, look into their mouth, down it's thrush, down is white, it's whitish, down behind their tongue. Yeah. That is candidiasis. Candidiasis is not only in the vagina. No, you also have it in where? inside all of pharyngeal candidiasis. The such patient now, such patient, we need a drug that will have local effect there. Even if you want to give systemic, fine, but drug that will have local. That's why you see some people using nystatin suspension. They will put it for children, even for adults. When you put it there, it will go. They have more contact with that place and clear it. Am I communicating? Then even some patient with vaginal candidiasis, vaginal candidiasis, they will still use antifungal like clotrimazole. That is brand name, popular brand name, Mycotin. They will apply it there either as an insert or as a cream. At that particular, it's for local effect. Because they believe that, so that within that space, the effect will be maximal if you come in contact with that area. Am I communicating? The same way, a patient that, as you are now, maybe you are playing football and you mistakenly, your leg and my leg will not have accident. I will now hit you. Maybe I'm trying to guard you. Superb up here. I'll guard you, right? So I'm trying to do that. Maybe I'm trying to push the ball. Bam! I'll hit my leg. There's no open wound, right? But the pain is there. In such situation, even though you may give oral medication to numb the pain area, but at that point in time, at that particular spot, you need to apply something there. Am I communicating? For local effect. The one you're applying there is for local effect that area. It may be nerve and bone, it may be topical and topical NSAIDs like diclofenac at that spot, because they are also what, anti-inflammatory at that spot. You need to apply it. Then you can also give to one the patient will take for what, systemic what effect that will get toward that, because that pain there is hitting somewhere. I hope you know. Am I communicating? Another thing that may come out of the pain. Then if you now ignore all those things and you don't know which and which to do, and the drug that is supposed to have more systemic effect, you go and start preparing it as giving the patient the one that have more local effect, you not achieve your purpose. Am I communicating? So these are the things you put into consideration before choosing the right choice of what? Route of drug administration. Now, the routes of drug administrations are divided into two. We have the what? The enteral and parenteral. Enteral and parenteral. Enteral and parenteral. Enteral and what? Parenteral, the one you call parenteral. Now, when you hear, anytime you hear anything enteral, you know that where you are got, where they start from. You are got start from where and end where? God. Where does God start and where does it end?